Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I wanted to share something with you today. I met a young dentist at a conference recently who shared a really interesting story with me. He had been reported to the board by a patient who had stated that she'd gone to another dentist and they had told her she had periodontal disease, and she'd never heard that before. So she reported to the board that her previous dentist, the one who's telling me the story, had never mentioned to her that she had gum disease, and she felt like she had been neglected. Well, the surprising thing was that this dentist was telling me that they had treated her for gum disease. They had done scaling and root planing more than once with this patient. And so he was really shocked, and everything resolved, but it got me thinking, how could this happen? And what can you do to reduce your chances of that happening? And a few things came to mind that I wanted to share. So one is creating a distinction for the patient. So obviously this patient, even though she had gone through scaling and root planing, as we term it, she never, or in her mind, the distinction had never been made between health and disease. The distinction had never been made with her that she wasn't healthy and that she had active periodontal disease. So first thing is the distinction, okay? Distinction. Now, perhaps they had educated her and, for whatever reason, sometimes those things happen that she didn't hear what they said. But I think it's important to remember the distinction because sometimes, particularly hygienists feel like, well, gosh, this is beginning gum disease and I can just do this patient a favor and treat this with a prophy. But what they're doing is they're missing out on the opportunity to make a distinction with the patient that something is different, that they're not healthy, that they actually have inflammation and infection. That brings us to the second piece. The second tip on how to avoid this from happening is using specific keywords. So one thing I really want you to listen out for is in your practice, do you ever hear anyone use the term deep cleaning? All right, this is something that I know in the past I have been guilty of using this word too. So we want to eliminate this. No more deep cleaning. You want to use terms like periodontal therapy, gum disease therapy, disinfection, right? And when we're explaining the disease, we want to be very clear and we want to show the patient the evidence, whether it's with just a simple explanation of the x-rays. I like to recommend that you print out their perio chart with all the bleeding points and pocket depths in color, and then explain what that means and where the areas of infection are and what your recommended disinfection therapy is going to be. So remember those key words. And you want to eliminate this. A lot of times patients think, well, I get 2 free cleanings a year, so why can't the deep cleaning be one of those? Or if I have the deep cleaning, then nothing different has been done. They just needed to go a little deeper. So really make sure we're making that distinction. The other piece obviously is documentation. Documentation. And I have a recommendation for you that's twofold, is creating a form, and we have something like this that we share with our private clients and our mastermind members, creating a form that you share with every patient with which you diagnose periodontal disease. And it simply states you have been diagnosed with, it can say moderate, advanced, beginning gingivitis, periodontal disease. The hygienist circles which one is appropriate for that patient and then outlines the recommended treatment. So instead of it being a treatment plan with every price itemized, it says we're going to do disinfection in this area, we're perhaps going to place local antibiotics, different pieces of the puzzle of your therapy, what is included in the therapy, and then, what are the dates, the times of the appointments, just a simple presentation sheet that you can share with the patient. And at the bottom it gives a little disclaimer on what happens if no treatment is done. What are the consequences of no treatment? And then the patient signs that they understand the diagnosis and whether or not they're ready to move forward with treatment. And then that document can be scanned and put into their chart or slipped into their paper chart. And then not only do you have that documentation, but you've also created, again, another distinction for the patient that this is something different. And of course you want to make sure that you always document the reason for any recommended treatment. You document the diagnosis, whether it's an abscessed tooth or active cavity or periodontal disease. You want to make sure you document that in your clinical notes as well, so that you have that backing up your treatment recommendation. So I want to always help you reduce your risk of being brought to the board or anything even worse than that. And so just remember, when you're looking at your patients and determining whether they're healthy or whether they have disease, let them in on it, right? Help them make that distinction and know that there's something different, and that you are recommending therapy for the active infection, and then make sure that you document that. So thank you so much. Please don't forget to visit our brand new website, inspiredhygiene.com.